vocal cord dysfunction, or VCD. So why are we here presenting this information to you? For starters, there is a high prevalence of VCD in athletes, and we hope that this informational session can increase the awareness of VCD in athletic trainers so that there can be an increase of identification of vocal cord dysfunction in the athlete population. We also hope that this informational session can help to build a stronger relationship between athletic trainers and speech-language pathologists.
So what is VCD? In order to understand what vocal cord dysfunction is, we have to understand what normal breathing looks like. So whenever someone is breathing normally, whenever they are not experiencing a VCD episode, their vocal cords are going to be open so the air can easily flow through. But if someone is experiencing a VCD episode, then their vocal cords are going to close as opposed to being open whenever they go to breathe in. This is going to cause symptoms including an irregular shortness of breath, which means that they are going to be short of breath whenever they go to breathe in, but they'll be able to breathe out just fine. They may experience an inspiratory stridor, which means that they will have a noisy inhale. It may be a squeaking or a wheezing sound. They may experience a choking feeling and throat tightness as opposed to a chest tightness that someone would experience if they had asthma. Also, it may present as a vocal change after an episode due to the experience that they've had of their vocal cords closing. And also they may experience a cough due to a VCD episode. So, what previous research has been done? There have been past studies that have shown that there is a high prevalence of VCD in athletes, but it is being misdiagnosed as exercise-induced asthma. So exercise-induced asthma, there's a lot of information known about it. So these athletes are being misdiagnosed with that as opposed to their actual diagnosis of VCD because it is misunderstood and there are similar symptoms. Also, VCD can occur in any individual, but it is highly prevalent in athletes who undergo intense physical activity.
So while the symptoms of vocal cord dysfunction and exercise-induced asthma are very similar, there are some strong differences between the two disorders that can aid in the differential diagnosis. For example, in vocal cord dysfunction, the symptoms are highly variable and often difficult to reproduce. And in exercise-induced asthma, the symptoms are very easy to reproduce under similar conditions. An individual with vocal cord dysfunction might experience throat tightness, while an individual with exercise-induced asthma may experience more of a chest tightness. The symptoms in vocal cord dysfunction occur during exercise and spontaneously resolve within 5 minutes after exercise, while in exercise-induced asthma, the symptoms typically peak 5 to 10 minutes after exercise begins and often spontaneously resolve within 30 to 60 minutes with continuous exercise. Some more differences between the two disorders. Vocal cord dysfunction, individuals will experience no circadian pattern, while individuals with exercise-induced asthma may have nighttime symptoms. And we already mentioned this before, but vocal cord dysfunction individuals may have an inspiratory stridor, that noise when they breathe in, and exercise-induced asthma individuals will have an expiratory wheeze, so a noise when they are breathing out. So who would you refer to if you had an athlete who you suspected had VCD? You would want to refer to a professional who is familiar with vocal cord dysfunction. Some of these professionals include allergists, ear, nose, and throat specialists, speech-language pathologists, and sports medicine physicians. It's important to note that not every individual within these areas are familiar with vocal cord dysfunction, so it's important to get in touch with them and make sure that they are familiar with vocal cord dysfunction and understand the diagnosis so that they can help these individuals out. All of these professionals will use a collaborative team approach to conclude with the diagnosis of vocal cord dysfunction.
So once an individual has their diagnosis of VCD, who is going to provide their treatment? Treatment will be provided by a speech-language pathologist, and they will be teaching different strategies for an individual with VCD to either prevent an episode from happening or decrease the duration of an episode once it is taking place. So some strategies that they will use are rescue breathing strategies, and an example of this would be to inhale sharply through the nose and then exhale through pursed lips or exhale on an S sound. And so strategies such as this just teach controlled breathing. They teach the individuals to take back control of their inhalation and exhalation so that they will be able to control their episodes or prevent them. And once these strategies are taught to an individual who has VCD and they feel comfortable using them, the speech language pathologist will introduce their respective trigger in order for the individual to use their strategies while they are in an episode or use them in order to prevent an episode from happening.
So if you have any questions or if you suspect that you have an athlete who may have vocal cord dysfunction and you would like more information, you can always contact the Marshall University Speech and Hearing Clinic at 304-696-3641.
Thank
Thank
you.
you.